faster, right? So it's nothing different in life, right? I say that the water is great. Too much water can be detrimental. So always finding the balance between helping the patient and staying safe in your practice. You work so hard to be here, so hard, right? You went to your nursing school 4 years, then you went to practice, then you went to your master's degree, your doctor's degree. So do all you can for your patient, but take it slow. And if you are able to fully explain the plan and expectations, the patients are likely to stick with the plan, right? So basically, every time I hear, hey, this is not going to work if you take your medications whenever you feel anxious, depressed, this is how the medication works. This is how I would expect, when I would expect to see a change, so that they know that it might take 60 days to get anywhere near the benefits. But if they know this, they're not disappointed after a week or, oh, it's not working. You would be surprised how many patients I get from other providers that stopped taking the medication because it wasn't working. Well, why wasn't it working? One, the dose is inappropriate. Two, it wasn't enough time. How can we say it's not working, right? So one little detail, we have to connect all the dots in order to say it didn't work. I can almost guarantee you, every time I go through the chart and see that the patient took 7 medications, and I started asking, how long were you on this medication? A month. In the lowest dose, did you see some benefit? Yes, but it wasn't fully working. Well, so what's the right answer? The right answer is to raise the dose for the medication to an appropriate level. And then patients get frustrated and they quit the treatment, right? Because it wasn't working. So explaining the patient when they should work, and you really develop expectations, proper expectations, right? So this is how my day was after we finished the class. Yeah. And if you were not in the class yesterday, I told you that the crash course review is uploaded. It's enormous amount of time, and I do want to apologize because sometimes my mouth run faster than my act. I try to give, and I just can't keep up 24 hours a day. I'm busy, but I did upload it yesterday. Yeah, I did upload it yesterday because I really want to help. I mean, I'm like so eager to do more, get more done. My wife's like, you can never stop. I'm like, I guess I can't. I try, but it's like always.
Thank you.
Yeah, always like trying to do more and
I
get
tried
more
to
done.
look for it. I can't find
God
it,
bless
Dr.
you,
Lopez.
doctor.
Yes. So
Dr.
whoever said
Lopez.
you can't find it, I name it All You Need to Know, or something like that, right? So there is a file there, it's a Microsoft Word, and guess what? Today, after I go to the hospital here, I gotta go see my patients and come back, and I'm gonna work on this document even more. I maybe 200 questions there.
Dr.
Uh,
Lopez.
yes.
This is Caroline.
Hey, Caroline.
I wanted to encourage my colleagues. I did the exam today and I passed.
Oh my God, another one.
Yes.
Good.
Thank you. Thank you for your material. I came from another reviewer, and I did your
Yeah.
30-day. So I wanted to tell my colleagues that the 30-day really worked for me. And also the one that you're talking about. I was in there last Friday and Saturday, and I took a week off to kind of review everything that you sent me. So I have to tell everybody that you can pass. I was the second test taker, but I thank God that I made it.
I know, guys, that gives me chills. I have long sleeve, you can't see it. I mean, this is like emotional in many levels, right? I mean, this is the most important test of your life. Don't take this as like it's a war. But it's a war of you against the test, right? So you don't have your colleagues there. So it's so important. That's when you break the shackles. That's the best way that I can say it, is when you can go on and do what you meant to do, and move from being a bedside nurse is a wonderful thing. I mean,
Yes.
I don't have words to explain the feeling. So I'm very happy that it worked for you. Super happy. And
Dr. Love, let me add one
yeah,
thing. This is
come on,
Hibo.
please. Hey, Hibo.
Yes, I passed also today my second time
Oh my
AAMP.
God,
I had
another
both of them in
one.
row. Yesterday I did the ANC and today AAMP. So this one
So you
was
passed
way,
both.
way better than the one I had yesterday.
Oh,
So I
wow.
want to encourage students that who are having a hard time with ANC, AAMP is much shorter. The number is 150, but the question scenario is very, very small.
Okay. So you passed both?
I did.
Oh my God, like back to back.
Back to back. I did it purposely. Yes, 14 and 15 today and yesterday. I just text you.
Oh, you
I
just
did. I
text me.
did two. That I have two of them, but I did the
Oh my
ANP.
God.
Yeah.
So yeah, because you came over yesterday and you passed yesterday, and then you went on the next day.
This morning.
See, guys, this is the plan, right? It's not about money. It's not about anything
No.
else. So go take both of them. Who cares about $200 test? Sure, I would like to save $200, but at the end of the day, it's your license. It's your practice.
Yes.
So go take both. Prepare like it's a war.
A war.
And see, and if you allow me to say, I think you took it before with somebody else and you didn't pass also, right?
Yeah.
Okay. And then you went back and took both, and you
Yes.
passed both.
Both. Yes.
I mean, back to back. One day she
Back
took
to
one,
back.
I believe,
Wow,
I think on Friday.
Yeah,
And then
so
she took
But
good.
I
another
have
one.
the reason is the 200 is not the goal.
Yeah.
Of course, it's 250. You're not gonna throw it away, but it's worth it. To do it instead of
Yeah.
waiting another 8-10 weeks or something like that.
Yeah, absolutely. If you do the test so well prepared go take both. I mean,
Yeah.
and the question bank really helps,
It is.
especially if you do 1,400 questions. It's almost impossible not to pass.
Yeah, I did
No.
all the 14 twice.
Twice, exactly like I said, do it
Why?
twice because
Twice, yes. I did it and then I failed, and then now I did it and I passed.
Can I ask you a
Yeah.
question, Dr. Lopez? Can I ask
Yes.
you, why did you do both? Do you get credentials for both? Why do you
you
do both?
could, but I
you
think the
could.
main reason I would say for people to do both is you preparing for this war, and you are going to win. So why? Things can happen. You can be well prepared and still not pass. Maybe the day your spouse said, "I'm done," or your kid says, "I'm running away from the house." I mean, things can happen, right?
Something will happen, yeah.
Yeah, and it can be super stressed. But if you take both, what are your chances? Your chances just increase by 50%. Well, 50%. I mean, you prepared. Why not schedule for both?
Yes.
Does it affect you if
So
you
Dr.
pass one and
Lopez.
fail the other one? Would they
No,
use
it
that
doesn't.
against you?
No, you
No.
won't fail.
Nobody cares.
Oh.
Nobody
Yeah.
cares. I
Mhm.
mean, I care, but nobody knows you did or didn't unless if you say
No.
it. Yeah, it doesn't. But why
doesn't.
not?
Where do I register for AAMP?
Mhm.
Where do I register for AAMP exam?
At their website.
Call their website. There's a number also to call there.
Am I new to
Yeah.
do both like she did?
I did both. I did both.
I mean, it's a preference. I think if you prepared, what matters really at the end of the day is not that small piece of money. It's not really. I mean, sure, everybody loves it a little bit extra, but at the end of the day, does it really matter? It's gonna make you richer, poorer, or
No.
it's gonna really put you behind? No, it's not.
At
I
this
mean,
point, you all need to pass.
Yeah,
But it
it's
means-
what you
That's
go
your
here.
goal. Yes.
But it means that you know your stuff. It means that you know definitely know your stuff.
But
That's what it
what it
means.
really means is, I think, to me, is that increases your chance of passing. Now you have 2 tests instead of 1,
So
right?
Dr.
What if
Lopez,
you don't
can
pass
I
one, you have the
can-
other one?
Can I say something?
Sure, please.
So I noticed in the my first exam, there was a lot of questions in ANCC that were too many questions, like they were so big, like to read them.
Yes, the scenario.
But the scenarios, but
Mhm.
the second time, like that I did take today, I think they have lowered the questions that they're not really that big over content that you'll read through. It's doable, it's manageable, comparable to how these exams were, because I took it last year in November and I didn't make it. So this time when I took it in today, it was not as horrible. So which means it's a good thing that ANP is here for competition, and they are seeing that a lot of people are taking it. So it's on our advantage. So I honestly think that it's more doable now than before.
However, you are absolutely right. However, it could be also how you felt when you walked in. Because maybe when you walk in the first time, you were not as prepared, so you felt flustered.
That's what I'm feeling. Yes.
Right.
Yeah.
So
you prepared the
I wasn't
same
prepared.
yeah, so things get easier as you get well prepared. They'll be like, oh, this is so easy. Oh, I
Mhm.
got enough time to review stuff because
Mhm.
those questions were no longer bothering you.
No.
And then people say, oh, there were a lot of medication questions. Well, it's probably not true. What's true is that the ones that you remember is the one that you could not complete, or you
Yeah.
didn't know the answer. So that those questions get stuck with the person, right? Gets in their mind. They're like, oh, it was a lot of questions. Well,
Mhm.
it's probably not true. It's just because you were not efficient on that topic, and it felt like a lot to you because we always hold on to the negativity of the things that we can't do when we kind of blow off the things that we can't sometimes, right? So because you were better prepared, I think the questions felt easier and more manageable because now you
Because we
relearned.
dive more into. That's what I
Mhm.
believe.
Yeah, it's probably very likely the same standard because
Same
what
standard.
happened
That's what
is
I believe. Yeah.
what they happen is they'll do the question, the trials, and they will say, oh, well, if it's 75% of people not getting this question, maybe the question is written poorly. So let's throw this question out. So they, only questions that come in is when the majority of the people are able to get it correctly, right? So now, because you really prepared, you took your time, because you took in November, I believe you mentioned, October, November last year, and now we're March. You really did a good preparation, at least 3 months or 2 months preparation, right?
I
So
did.
plus what you knew, plus what you learned, it's what made the difference. I think it could be true that the test was
Yeah,
easier.
the content.
It's a possibility, but is how
Yeah.
you prepare that made the difference. It made you feel that that the questions were easier. I think as you have grown a little bit
We
more
boost up
well.
our knowledge. That's what I believe, that we boost up our knowledge.
Yeah, well, so it's
That's
a
the only thing
blessing.
makes it easier.
Yeah, blessings every day, and there is two things too that I wanted to bring to you guys that just passed. One is that if you wanna precept and earn a little bit more money, please let me know. You can use the Facebook, but all what I ask is not to charge students a lot, right? Because we all been there before when no money is hard. So be fair. And two is I have a blog. If you want to start writing the blog, what I'll do for you is that put your name out there. When your employer goes search your name and they say, hey, this person has actually written few blogs, few posts about mental health, automatically you get credibility. So if you want to write some stuff and want to get with me, I can post it on my blog, and then you can start putting in your name. I'll create a Google profile for you, start building you up for more earnings in the future, right? And helping, and don't charge people what you don't want it to be charged when you were a student, right?
Yes.
So these are opportunities that we can do for you, and I'm always looking out for jobs. I helped two of the students get into bonus jobs. So helping each other, that's the goal too, right? So it's not
Yes.
only helping ourselves. I mean, so yeah, well, that is extremely exciting. Now, guys, if you were not on yesterday's sessions, I think it's very valuable when you come to the live sessions, because no live sessions will ever be the same, and it's always someone says something, or the way I say it in a different way, it kind of benefits you. But ultimately, the entire program is online, self-paced. You should have gone through the self-paced first, ideally before you attend the live class, so that the live class is the second pass. It's an opportunity to relearn or ask a question in different ways, or clarify your questions, right? So yeah, I mean, super excited. Congratulations, both of you guys.
Thank you very much.
Guys
Thank you,
rock.
thank
I
you.
mean,
Last question,
is-
Dr. Lobos.
please.
The farm class, I signed it that December
Oh,
last
yeah.
year.
Yeah,
So
no
how do
problem.
I get to that link?
I believe it's the same link for the course, and then you just choose the psychofarm class. Now,
Oh, okay.
the psychofarm class, if it's not true, or if you having problems, send me an email at PMHNP at
Passive email.
npexamcoach.com.
Mhm.
Now, the psychopharmacology class, it will take you for a loop. I guarantee you that it is better than 95% of any college out there, and you can include the highest named colleges we have. Okay, it is a long program, but I'm going to break it down each mental health medication to its core, to its receptors. At the end, I know it's long. At the end, you'll be able to mix any medications in your dream, right? I mean,
So
you'll
that-
be able to like really get to the core. Yesterday, I was teaching ED doctors how to treat serotonin syndrome, right? So I got 3 doctors and put them all in a room and say, here's where your choices. Here's where I recommend. Here's a medication that is less likely to cause this. So my patient couldn't eat, having diarrhea, sexual dysfunction, couldn't sleep. What do you think a medication that it could switch potentially if a venlafaxine wasn't working as well for him because of serotonergic? What do you think I could switch? Another medication?
Wellbutrin.
Wellbutrin, yeah, but he's anxious, super anxious. So if I give him a Wellbutrin, initially it will increase his anxiety. He already can't sleep. He's already very anxious. What is one medication that would maybe benefit him in all aspects immediately? Remeron, right? So it would not cause as much nausea because the receptor it works is different than venlafaxine. He's not eating, he's not sleeping, he's anxious, right? So Remeron would be a good choice. Initially, the course of action was to stop all medication for 24 hours. I prescribed him Ambien, 2 Ambiens, one for yesterday night and one for tonight. That's it. And I will see the patient on Monday morning. So I took all his medications. I have systems that I can take, all his medication from his house, patient safe, discharge to see him on Monday morning. But these are tools that are really, if you are able to mix your medication and you're very comfortable, I mean, you golden, and you'll be able to ask your employer for more money because you really are worth it, and they will be paying you more. I guarantee you. Once you bring results, you can ask them, significant amount of money. So what's gonna take you is the ability to dedicate yourself for another 3 months. In a way that your college may not have taught you before, because they're more concerned about meeting the standard, and now you're concerned about exceeding the standards, so that it really builds you the beautiful life that you want to, right?
Beautiful.
So Doug, everything we can find it on the course, or we have to send you an email? I don't know about that.
No, you can go to www.npexamcoach.com and sign up for the Psychofarm. Go ahead, send me an email, and they'll give you a discount. Guys, this is not about, like if someone wants to buy something for me and it has been my student, I don't mind. I mean, it's crazy, right, to say that, but trust me. Just send me an email. I'll send you a very nice discount if you already have it. I want you guys just to succeed and do well. I
Okay,
mean,
thank you so much. I will
Thank
do.
yeah.
you very much. Yeah, I will look my
Yeah.
email.
Yeah, PMHNP at npexamcoach.com. But welcome again, and thank you so much. If you are new today, this is the Kahoot game, where we kind of teach and we'll go over some of the principles that we covered in yesterday's class. So if you attended yesterday's class, you should be winning today, guys. I mean, that is the goal, right? Let's apply what we learned yesterday. At this moment, is anyone not able to participate? All right, so let's the game begin. Okay, go ahead.
I have a quick
Jen.
question.
Sure.
Is that some state don't accept, they only accept the ANC tests or?
It is true.
Okay.
I know at least one state or two. However, there is a lot of confusions out there, right?
Right.
Some people say this state doesn't accept or this doesn't accept. So what's the right answer? Calling or email. Don't even call. Email your nurse state board and then
Okay.
find out directly from them.
Okay.
Because that way it doesn't rob you. Oh, I heard, and then you believe it's true. When the person is not lying to you, is that the information they received may be a month old, and maybe
Oh.
back then they didn't accept. Now they do. But there is one state that is in review. I don't want to say what state is, and maybe others. I don't know. I'm not going to every state, but I would say email your state board of nursing and find out.
Okay.
Yeah,
All
but
right,
it is a good benefit to take both if you can. You know,
Well,
why not?
I believe so.
Yeah.
It makes sense
So-
because if you fail one, you pass one, you still got the license. So
Yes, Carol, I see that that you can't participate, but stick around. I think we're gonna share some good information, especially from yesterday's lecture. Anybody else has a question? No?
Yes, Dr.
Please go
Lopez.
ahead.
So I cannot be able to do the Kahoot because I only have a cell phone and I'm
Okay.
driving.
Okay,
But,
so if you're driving, don't do the Kahoot, but stick around and listen. And if you can, stop the car if you can and read the question. You don't have to necessarily participate, but next week, if you can, it is good to participate. But thanks for letting me know, though.
All right, thank you.
All right.
Sorry.
Alarbibi, oh, I'm sorry, I can't see your name there. Can you have a question, please? Ask. You have to unmute yourself. Rosemary, I think you have a question.
I just want to ask, what did you say I should do, Dr. Lopez?
Oh, I just if you can just reading the question would be helpful, or if you can't, stick around and we'll discuss some few points as we. If you are on the phone or calling in, you will at least be able to read some of the rationales.
I was just about leaving now. I am towards the tail of my shift, so it's busy.
Okay. Okay. No worries.
So,
No
I'll
worries.
be leaving in a minute.
Okay. No worries. And this will be recorded, by the way. This I'll post on the YouTube. I'm no longer posting the course, otherwise I will make this a 3 years course, right? So I'll be posting on the YouTube, and you guys can always watch it later if you can't. I would have definitely advise you to do so, to watch it on the YouTube, and I'll put the YouTube channel here later. All right. Last question before let's get started. Pamela, you have a question there?
Yes, you may have already answered this. I'm just sort of
Oh
hopping
my
in.
God. I
With
would
the
love to
live
be here.
lecture yesterday, it was recorded and we are able to view it because I had to leave early.
No, yeah, unfortunately not, because we do this several times, right?
Okay.
What happened is that we had recordings for the live in the past, so it is available for you. This is on module 11. Yesterday we didn't record because if we keep recording every time, it's going to make it overwhelming for you guys that are coming in. I'll be like, which one do I watch? They are the same thing. Okay.
Okay.
But I have it pre-recorded on module 11, previous live event. So yes, we do have a recorded previous one.
Okay.
Okay.
And it
All right.
covers the same material.
Same thing. There is nothing new. Sometimes we repack the same thing, say it in a different way, but it's the same thing. The
Okay.
important thing is that if you come across something that you don't understand and you need help immediately, or either go to the WhatsApp group and ask your students, so to get immediate answer from different perspectives, or email me, and then I will rewrite it in a different way that may be helpful to you.
Thanks.
Okay. Rosemary, do you have a question there or no? You have to unmute yourself. I'm not sure if you're there, so we'll get started then. All right. So I don't hear you, Rosemary. We're about to get started. So today, guys, is Kahoot. Few things about Kahoot. Kahoot is fast, meaning that you only have a minute, the most, per question, right? So
No
it's a little bit.
questions.
Okay, thank you. So in the task, you should be aiming for a minute and 10 seconds. Here you have a minute. Kahoot, you do not have a complete answer, right? It only allows me to put like, I don't know, very few characters. So I have to give you a incomplete answer. So my goal is that at minimum, you kind of think where I'm going with the answer. And always pick the best answer. Some answers will be more than one correct, but again, it's back to the nursing. Which one is the best answer, right? So sometimes it will disagree, and that's completely fine. But yeah, so be fast. You get points for being correct first, and you get points for being fast. Good luck, everyone. Let's get started. Twenty seconds left. Pick your answer. All right. Well done, everybody. Right. So, yeah, the best definition, it is serotonin and norepinephrine. Becca, Rich, Ebony. Ebony is here all the time. That's good. And Becca too, and Rich too, Caddy and Pam. You guys are here all the time, and you took the first 5 spots. Good luck, everyone. Next question. Well, let's review this real quick. So if you think of serotonin and norepinephrine, right? You got to think which conditions or mental health conditions are usually related to that. Yesterday we went over in one word. If you think of serotonin, what would that be? Mood and sleep. How about norepinephrine? Fight or flight. How would you pick this question? Here says low level of serotonin here are often related to depression symptoms and sometimes anxiety and anxiety symptoms too. And we also mentioned OCD, right? While the imbalance, it is the proper terminology between those uh, I would say not receptors, neurotransmitters there, right? It's what makes it either go good or bad, right? So norepinephrine, it helps, it could contribute to anxiety, right? If it's too much of it. So the presentation here is depression, anxiety may suggest of both neurotransmitter systems being involved. Okay, next question. Okay, so yeah, this one is kind of hard. Between lithium may be lower due to alcohol metabolism, or lithium may be higher due to the decrease in renal clearance, right? So that is the best option, right? Now, if you really think of alcohol in a global perspective, what does it do? It make you want to pee, dehydration, right? And how is dehydration related to lithium? We learned that lithium, it's very, very likely to have a lot of questions on lithium, right? Because one, it's the gold standard for bipolar disorder. Two, is neuroprotective medication of a choice for those with bipolar. Three, it has a narrow therapeutic window, zero point 0.6 to 1.2. We also learned if the level is 1.3 to 1.4, assess your patient. It's not necessarily a discontinue. We also learned that if lithium is too high, your first action is not to collect lab, but to discontinue the medication, right? It is likely that you always have questions about patient education on lithium, right? Because affects everyday life, dehydration, alcohol. These are things that are common in a lot of cultures and especially in the US, right? Someone's working outside, going hiking. What kind of teaching should you be doing? So, yeah. So, and high increases, high levels of alcohol could potentially affect your liver, although lithium is related mostly with kidneys, right? So we also learned that there are few medications that will double the lithium level, such as, anybody remember yesterday?
Antacids.
NSAIDs, yes, absolutely. NSAIDs is a huge one. We also talked about thiazide. We also talked about ACE inhibitors. And one key point for the ACE inhibitors is a medication known to treat what condition?
Listen up for heart failure.
Heart failure.
Heart failure, right? Heart failure. So these are key points from yesterday. Glad you guys remember. Next question. Wonderful. You guys are nailing it. Good job. So what we discussed yesterday, good job there. Becca took the first place. She was too fast, huh? Jennifer that got the fifth place. So good job, everyone. What we learned yesterday? Any time for any medication, doesn't matter which medication, what are we talking about here? Anytime you have someone who's stable on a medication and something was added, do not jump to conclusion. This is about inhibitors or inducers. For example, if you have someone on Lexapro doing well, stable for anxiety, let's say depression, and however the primary care provider added prednisone, don't jump into conclusion that prednisone is either inhibitor or inducer and then start running scenarios in your head. Ask yourself, what are the medications that could cause mania? What are the medications that could cause depression? If prednisone is one of those, which is, in this case, it could destabilize your patient. You have two actions. Action one is increase your medication, increase the Lexapro. Action two is to collaborate, right? This in this specific question here applies in the principle of if your patient is stable, your first action is not to switch your antipsychotics, but rather collaborate with the dietitian for lifestyle changes, right? Now, if that is not an option, then you pick something that is least likely to cause a metabolic syndrome. Now, what we learned yesterday? Two classes of medications. There are antipsychotics, first generation, or also called typical. They are more prone to EPS symptoms. Atypical or second generation, they are prone to less EPS, more metabolic syndrome. Can anyone tell me what are the signs of metabolic syndrome? Give me 4 signs.
Increased hip to waist ratio.
BMI.
Yes. Hold on. Let him finish this. He took the mic. But yes, please. We got you. So increase hip to ratio, circumference or circumference ratio, BMI. What else? I think it was reach.
Triglyceride.
High blood sugar.
Okay. High blood sugar. What else?
High lipids.
Right.
Yep.
High lipids.
Lipids, triglycerides. You only need 4. I'm sorry. You only need 2 to call it a metabolic syndrome. Okay. So know your skinny drugs, as I call it. It's not the right terminology, but I call them the skinny drugs like Latuda, Acenopine. What else? Abilify. What else?
Zapruzdone.
Okay.
Geodon.
Geodon, right? Okay, good job. Remember that Clozaril and the Olanzapine, specifically Olanzapine, they are more prone to cause metabolic syndrome. Clozaril you should only use after you had 2 trials of other medications and they didn't work and you're running out of choices because it's a potent drug. However, it has the risk for agranulocytosis, right? Key point about agranulocytosis, ANC less than 1,000, you stop. White blood count less than 3,000, you stop. Any sign of infection, whether is a 100.5 warmth, not even a fever, you stop. A sore throat, you stop. Why? Because of the risk of agranulocytosis, right? Yeah.
You talk about, oh, sorry, go ahead.
Yeah, hold your question because I pressed the button. We'll go back to that.
28.
I got it. I got it. I got it. I got it.
Your mic is on, just to let you know.
Sorry.
This one's a hard one, guys. All right. Anybody surprised?
Yes,
Yes.
I am.
Okay.
Yes, definitely.
Okay. Okay. Yes,
Yeah.
this one was hard. Okay. Very hard. Very hard. But what did we learn yesterday? I said that anytime you have persistent, what is the other word that I used yesterday? It said persistent. I said excessive.
Course.
Any course,
Severe.
right? Yeah. So I said in the questions, even though this was a bad question because it didn't give you a whole lot, right? But it said persistent.
I thought persistent meant coarse because I thought fine
Yeah.
tremors you couldn't see.
Exactly.
Yeah.
Yeah, you can take it that way too. Is a way to, but in general, anything that says severe, especially severe, or persistent, it's not a side effect. We look in toxicity. If you encounter questions and you're like, oh, is this a normal abnormal or toxicity, look for the keywords like persistent, excessive, specifically excessive, right? It could lead to toxicity level. Although this is not a fair question because it is true. It is true that is a potential for lithium-induced leukocytosis, right? And also there discontinue lithium and switch to alternative mood stabilizer. However, is that what we really want to do? Do we want to discontinue lithium and switch to something else? We want to, here it's not so much that it is in a toxicity level, but we want to assess here, right? Because they only give you two symptoms. I think it was hand tremors and something else, right? What else was there in the question?
He had leukocytosis. Isn't that a
Look, yeah,
leukocytosis?
leukocytosis, sure. But does it mean it's a lab value? But it doesn't necessarily mean that it is explosive diarrhea or vomiting that's gonna completely imbalance. So it's to assess for toxicity, right? But I get it. This one is hard. Okay, it was three possible answers, right? So don't
Well-
feel discouraged. This one is a bit hard for sure. Okay, so
The one
assessing
answer
for
is stop
assessing for
the
the
med come in first, because first you stop the med. What's the priority? Stop the
yes,
med.
yeah, you're right. You're right.
And- but the second
Yes.
half of it isn't really where you want to go. I see that, but without stop the med, the other one is not
Yes.
correct.
No, yeah, you're right. If you this one would not be a question on the test, right? So the way it's written is poorly written because it's three possible questions. So if you pick to either stop the med, you're right. If you pick assess for toxicity, you're right. However, in the question, in the test, they should give you more symptoms, a little bit more. In that case, if they give you a little bit more, the right answer would be stop the med. But not necessarily to switch. You stop the med and you assess and collect labs, right?
The way I saw
So,
it is that
yeah, go ahead.
the way that I saw it is that the question didn't have enough information. So
Exactly.
if you don't have enough information, then the first thing you do is you go back to your nursing process, and so
Right.
you would assess.
Yeah. So you are absolutely, and that's what I was trying to convey in here is that not giving you a whole lot. I'm giving you a curse, hand tremor, or persistent here in disguise, and I'm giving leukocytosis. Okay, not giving you a whole lot. So assess, but it would not be incorrect either if you stop the med. So those that picked stopping the med, you are correct as well. Okay, so it's just not it was a very fine line between both of them, right?
Yes.
So everyone really did a good job here. Even if you pick leukocytosis induced, would be still correct, right? Remember, I can only put few characters in the answer, okay? I'm very limited to what I can write as the complete answer. Okay, again, which one is the best answer, right? So we're looking at the blue and the green answer. The green is not necessarily incorrect, but at the end of the phrase, it said as often as you need, right? Check lithium level as often as you need it, right? Compared to lithium really should be taken preferably at the trough and preferably in the morning and preferably around the same time, right? To keep it consistent. The green option there, I think, as often as you need it, it implies that whenever you want. And that wouldn't be necessarily the best answer. Not as strong as the blue option. And that is the rationale there. There was someone that had a question before and that was a bit too fast. You still have a question?
Doctor, it was me. You were talking about hide by circumference, something like that. I didn't get. So when you were talking
I
about,
mean, I would say abdominal circumference
Mhm.
or hip to waist circumference is often used as the same thing, right? So
Mhm.
that is the first physical sign that you see of
Mhm.
metabolic syndrome. Now,
Oh, okay. Thank you,
right?
doctor.
Yeah. Now you might see other signs early, but you really only see if you get the labs, right? So okay. It is the best option here. Most of you guys agree. So we should take lithium with a full glass of water. It didn't allow me to write all that. To prevent irritation and allow for the correct amount of absorption. Okay. We talked about, okay, oh, wait. All right, so C there is MAOI. Okay, it was a mistake there. Sorry. Should have said faster, but okay, thank you guys. Sorry about the misspelling there. So yeah, in any case of any kind of toxicity that this toxicity level, you really should discontinue the medication, right? Especially when you have a hypotensive crisis. So yesterday we talked about medications that could potentiate hypotensive crisis. MAOIs should be the first one that comes to mind. Do not prescribe MAOIs with stimulants. Do not prescribe MAOIs with albuterol. It could be another one. We talked about what to do, right? In this case, it really is directing the patient to the ER, ICU, right? But there are some medications that we could potentially, that not necessarily would use, but it would be the right case to decrease the blood pressure. Okay? Remember, I'm only allowed to put few characters in an answer. So most of the time it's not absolutely correct, right? So gradually tape off lamotrigine and explore alternative mood stabilizers, such as, give me an example then. What would be the alternative better option to lamotrigine?
Valproic acid.
Say it again?
Valproic acid.
Not necessarily. Do you think valproic acid?
I mean, it's
would-
bad. It's bad for pregnancy.
Right, right.
I
Right.
thought
So
that's what you
we're
were
looking
asking.
for, yeah, we're looking for something that would be better for lamotrigine. So ultimately, in my eyes, well, that's for mood
Zoloft.
disorder, right? So we're talking about uh, bipolar like case. So if we're gonna give a Zoloft, we're gonna make the
Buspar?
problem. Okay. So
Galectin?
let me go back to the question. Let me rephrase the question. The patient has bipolar. Which medication could, for those that picked a blue option, which medication could be better, if any, than lamotrigine? That's question number
Buspar?
one.
No.
Lithium.
For
Okay.
mood.
Lithium
Exactly.
has really bad side effects.
Exactly. So
Anomaly would be lithium. So the risk.
exactly. So we would not do that, right? So I'm asking for one, if there is one that would be better. That's question number one. Question number two is the risk benefit, right? Let's say, I don't know statistically, what's the, let's say, I know it's very, very low. Lamotrigine is usually considered the safest.
Yes, lamotrigine is
So compared to not using lamotrigine at all and not using anything else because it is not a safer option, the patient becomes manic, gets run over by a car, or gets in trouble in some way, somehow. Which one, again, there is no perfect solution, but which one is the most beneficial to the patient and the baby, right? So the most beneficial case for the baby is to stay on lamotrigine because it's the safest, yet it's not 100% safe, but compared to a patient that's stabilized, destabilize the patient and give nothing, or give alternative medication that is likely to be worse. Does that make sense? It's like saying, I will never give antipsychotics because someone could have TD, right? Well, which one is worse? It could. It doesn't mean it will happen to begin with. There's a potential that it could happen versus the potential of not being able to do anything and being with psychosis every day. Which one is worse? Right? I wish that was 100% safe and never nothing will happen. This is the only impossible solution. But oftentimes we have to deal with risk benefit. As I mentioned yesterday when I saw my patient, there is a potential that I could be wrong, and I discharged the patient from the ED, and I received bad news this morning, right? There is the potential compared to the potential of me taking his freedom away against his own will because he has thoughts of suicidality, right? Which is not the right answer either. So no matter what you do, there is risks involved. But which one can you back up with EBP, right? Evidence-based practice. So how is your rationale for discharging? So the doctor yesterday, he actually wrote the case and then put his rationale why he made the decision to discharge the patient after he consulted with me, after we had the plan in place and the risk benefit. And that was beautiful. I liked it.
So, Dr. Lopez, this is a case of the benefit outweigh the risk.
Yes, absolutely. Okay, very good. Yesterday we said that you don't need to know all medication. The test is not about medications alone, but any FDA warnings you need to know. We highlighted Depakote, right? And we said pancreatitis and what else?
Hepatitis.
Hepatotoxicity.
Yeah,
Hepatotoxicity.
hepatotoxicity
Yes.
and pancreatitis. And I also said you need to know the symptoms of hepatotoxicity and pancreatitis. And we mentioned oily stew for pancreatitis is a possibility, high yield there. And I will highlight that on the upcoming chapters. Somebody has a question?
Yes, Dr. Lopez, not on this question, the one previous. What was
Okay,
the best alternative medication? I didn't hear it.
there is none.
Okay, so what do you do in this case that the lamotrigine, what was the rationale? Continue?
So it's continuing the medication because it's the safest medication, and that's number one. And number two is the risk benefits of discontinuing the medication, and the patient become manic and may lose the baby, may have an accident, or may harm the baby in some ways. Much more harmful than stay on the medication, like excessive drinking for 3 nights in a row and not sleeping. What do you think that would cause to the baby, right? Or starting drugs when she never started or never tried before. But in a manic state, we cannot necessarily rule out that would be a possibility, right? So
Thank you.
yeah, no safest medication. I'm not saying it's entirely safe either, which is not. However, the risk benefit, there is no better medication one, and the risk benefit of the medication versus not having the medication. Okay. Next question. Okay. If it's kidney, it's BUN and creatinine. If you're concerned about liver, ALT, AST. Uh, Other options, if you're concerned about thyroid, TSH, T334, right? So the basics labs, we must get this question right because it's likely that you see all four labs or groups of labs in your test in one way or another, right? Here's the rationale. Take a minute to read, please. hard question because they didn't give you any solid answers here, right? So BUN is normal, thyroid significant, but it doesn't necessarily apply within normal levels. Then we have a sodium level that's slightly decreased, and you have your creatinine, which has a lot to do with kidney function, right? But which one is slightly hair, tiny under hyponatremia? Remember that hyponatremia could potentially elevate lithium level, although in the test I would highly doubt they would say 134. They might say 129, 130, right? 134 is too close to really be concerned. But again, if we were going by the book, that would be hyponatremia. Again, the question should have said 129, right? To be make it more easy, distinguishable, right? Now, if the creatinine level was a little bit more, it would probably take precedent over the sodium level, right? Because it could possibly indicate dehydration. So we covered this yesterday as well. All right. Yeah, so all of those mood stabilizers, ideally you want to have a little bit of folic acid in a mixture if it's a female and concerned about pregnancy, right? Just trying to minimize the risk of neurotube defects or compromise the fetus. Will it actually 100% protect the fetus? No, it will not. But you're doing what you can with what you have available, right? And documentation is the most important part out of this process, right? You want to document all your teaching, and I highly advise to collaborate in real life here with your OB doctors, right? So basically, having the visit, if you're initiating that kind of medication, explain what your plan of action, and then say we'll consult with OB doctors for further evaluation and complete plan of care, right? So don't take this one alone. It's a hard decision, right? It's one that keeps me up out of anything. Is like a pregnant woman with a fetus, wanting to be pregnant, and the mood stabilizer is not an easy decision. It's just one that you have to be comfortable. So every time, look for evidence before you prescribe it, right? Solid evidence and the collaboration with the OB department. All right, so you want to assess, right? You want to assess to determine the dietary habits. Again, it doesn't allow me to give a full answer, right? So this is the best I could with what I had here, allowing me to write it down. Compared to initiate cognitive behavior therapy to address maladaptive eating behaviors or issues, right? Again, not a bad option, but is it better than assessing first? No, right? So you want to assess what are the eating habits and what is causing the person um, to pursue the routes. What are the stressors and habits forming before you say, let's start behavioral health CBT immediately, right? Without assessing. So usually involving nutritionist would be the also part of the answer, right? So the core of the question is, how is bulimia different than anorexia, right? So few points about bulimia. They usually have normal BMI, right? And the distress comes from eating or overeating and then feeling guilt about it. Right? These are key points. Few things about anorexia is that is marked by the excessive fear of gaining weight. They have the distorted thinking. Look how I look. I look obese when in fact they are anything but obese. They have a low BMI usually, right? Anything really between 16 and below, it requires an admission. The patient's at dangerous, right? Remember how we covered refeeding syndrome. Think of someone that's not eating, and now you admit the patient, or the patient start eating larger amount of food. Doesn't have to be excessive, just larger. Their stomach are not especially if it's chronic, a long time not eating, they have really shrinked and their ability to digest a large amount of food, it's gone for temporarily, right? So they have the refeeding syndrome that could happen, which is a shift of electrolytes out of proportion. So we'll cover more of this in the upcoming lectures.
Dr. Thales, never mind.
Yeah, I can't, but please hold the question. I want to answer, just I can't stop now. All right, so the question was kind enough to say doxepin, like I think it was not doxapine, dicycline, right? I think it was the other medication.
Doxycycline.
Doxycycline, thank you. It would be an inhibitor of a carbamazepine. So what is your action? If it's going to inhibit, the test would never, I mean, I hope they do it. They will say that this is an inhibitor or inducer. They will not tell you that. Most of the time they won't. But if they did, that's bingo. That's a question that we cannot afford to miss, because we went over the concept yesterday. If it's an inhibitor, it inhibits the other enzyme, the other substrates from being breaking down. Therefore, more of it's available. Think of you inhibiting someone from leaving your house, so you have more people in the house, right? So what is your action? To decrease the dose, right? Now, be careful between what is your action and what is actually doing it, right? It's what's doing it is increasing the dose. What is your action is to decrease the dose, right? So it's be very clear. What is doing is increasing the dose. Your action is to decrease the dose because more of carbamazepine is available in the body. It's not being broken down properly by the enzymes there. Any question on this one before we actually see the rationale? Because this is so important. You will have a question on these topics for sure. Maybe more than one. Did anyone got this confused for some reason that want to kind of explain the reason why you picked? It's important to understand the why so we don't make the same mistake.
I didn't. I bypassed looking at what it said it was, and I saw antibiotic, and I thought antibiotics were inducers. So that's why I didn't look at the full question. I read it too fast.
Okay, so we learn that way. It's very important that those type of questions we don't blow off and be like, oh, so every time we get something wrong or we don't necessarily get it the way we should, is a learning experience so that we don't make the same mistakes. So thank you for sharing it very much. Do we have somebody else that want to kind of chime in?
I got it wrong because we've had a question before where when it's a short-term dose like the doxycycline will be, that you stop your med while you're taking the one that might interfere instead of adjusting your dose all over the place. We've had that question before.
Okay.
And I got it wrong then because I said what this answer is.
Okay. So I want to kind of go back to your first point. I think it was Rebecca. I'm not looking at the screen, so I know by your voice. So I want to go back to the first point. When you have a medication and somebody else adds another medication and destabilize your medication, or it can be only usually are 2 points. So either it's an inducer or inhibitor point, which is this question, or the other one, it could be that could cause mania or depression. If that could cause mania or depression, that's the point that I wanted to highlight. Your options are only two: increase your medication, not stopping your medication, or collaborate with the PCM to see when this is going to stop or so forth. But usually, I want to go back to this point, usually it's to increase and adjust your dose, not stopping. Now, I don't remember what question you're referring to. I'm generally speaking, okay? But this is very, very important that if you have a patient that's stable, the question started by saying the patient was stable for whatever, and something was added, then you have to start dividing how you will attack this question. One, look at your acronym. Is this an inhibitor or inducer? No, it's neither of those. Bingo. Now we're going to look whether it's a medication that causes depression or mania. We looked at our acronym and we know that's neither one of those. So now, or it is one of those, then we're going to increase our meds or collaborate. Usually it's to increase our meds or adjust our medication accordingly. right? There was a question. Let's see the rationale and answer a question that we had before this one.
So the question I had was with refeeding syndrome,
Mhm.
is that one that causes a hyperammonia level?
I think the
Or is it just electrolytes?
It's more electrolytes. So what causes hyperammonia level is what drug? Anybody?
Hypoammonia?
Hyper.
Depakote.
Depakote.
Yes, yes.
Okay,
High
thank you.
yield. High yield. Please make a note of that. Very important. Ammonia
And that's
level,
treated,
right?
what's that treated with, Dr. Thalles?
Well, it depends. It can be mainly treatment. Anybody wants to give me a a treatment for this one? We
Bipolar.
can say it again?
Bipolar.
No.
What's
Ammonia level. How do we treat high ammonia level?
they have to
Lactose
lactulose.
enema.
Lactulose.
Lactulose, right? You can just poop the thing out. It can be that way too, right? So yeah, but usually, yeah, that will do it, right? Now, yeah, great question. Thank you for asking. Highlight increased ammonia level. Ammonia is a lab value that you want to check when someone is taking Depakote. Yes. Okay. So if you were in the class yesterday, I hope you got this one right, right? Excitatory. The Okay. So make sure you got this one right. Which one is the most inhibitory neurotransmitter?
GABA.
GABA, right? Excitatory glutamate. We covered this yesterday as well. All right, nothing to say about that. Well done, everyone. Great job. Make sure you know where your neurotransmitter are synthesized or produced, made, created, whatever, but you got to know each one of those, okay? Yes, we covered this too yesterday. Guys, visual hallucination, lights, unable to see properly. If the eyes are healthy, it is the occipital lobe. Okay, you gotta know your lobes really, really well, because you will get tons of questions on the lobes, whether it's in reference to schizophrenia, ADHD. It will not likely to be a direct question. What does it do? But in reference to a condition, psychiatric condition, and where does it come from, right? So visual processing, it's part of the occipital lobe. Pay attention on the parietal lobe, right? Sensories, all the sensories, right? And partial awareness, integration of sensory inputs, all the sensories, right? Smell, reading, sense smell, warmth, things like that. That's going to be your parietal. This is not the primary region for the visual processing or perception. How are they different? All right, let me pick on somebody here. Let's see. Sunny, you were in the class yesterday, right?
Me? Or
Yeah.
yes, sir.
Okay, so what the mesocortical pathway do?
So with the mesocortical, we have decreased dopamine in the mesocortical pathway, and we have negative symptoms. So we have amotivation. We have flat symptoms. Amotivation. Let's talk about it. I forgot. Amotivation. What is it called? Adonia.
Anhedonia.
Anhedonia.
Yeah.
Yeah. So
How
we
about
exhibit all negative. Go ahead, sir.
how about the mesolimbic pathway?
Mesolimbic, we have increased dopamine in the mesolimbic pathway. So we have positive symptoms such as auditory hallucination, visual hallucination, disorganization of thoughts and speech, all of that. Positive
Okay.
symptoms.
All right. How about the nigrostriatal pathway? What's happening there?
So with the nigrostriatal pathway, we have decreased dopamine, but we do have increased acetylcholine, which also can lead to increased EPS symptoms such as acute dystonia. We also have acute dystonia. We have TD, tardive dyskinesia, which can be treated with Asueto. The VMAT, which is Asueto and was it Ingresa? Not Ingresa.
Yeah, Ingresa.
Ingresa. Yes, sir.
Ingresa. Yeah, perfect. And the tuberofundibular pathway.
So with the tubulofundibular pathway, we have decreased dopamine and elevated prolactin, which can eventually lead to osteoporosis in clients if it's not treated on time. And also we have symptoms such as decreased menstrual amenorrhea.
Okay.
We have
So
galactorrhea
okay.
and
All right.
gynecomastia. Thank
Okay,
you.
very good. So excellent job. Highlighting here a few things that she said. Tubulofundibular pathway, osteoporosis, osteoporosis, osteoporosis. So well done. So thank you for helping me out here. Yeah,
Thank you.
very good. Danny said he got 82, I think was the message there on your second diagnostic test. So guys, the goal is for you to really test it once on your diagnostic test. And if you're scoring like 82, I'm telling you, you're a gold. I mean, you gold in there. Just make sure that you send me an email. Look at the document that I uploaded in a course yesterday. I got 84 on the first one. I mean, you guys are killing it. You guys really, really getting this thing the right way. So I'm very, very proud that you guys are doing it. You know, you can see that it's not about only passing the test. You're really getting the knowledge, and then you'll be like, okay, I feel more confident. I feel that I got this. I don't feel so uncomfortable anymore. I'm like, I can take care of patients. I can do this, right? And that is the goal, to really build you to the next level, so that as soon as you pass, you'll be like, okay, where's my job? I want my job. So Danny, you had the question there?
Yeah, I was just like to say, because since I got 82, like I still don't feel like it's not enough.
Yeah.
I don't know.
I mean,
like,
you're hungry, man. You're hungry.
Yeah.
You
I got
know,
92 on the first one, and then
Yeah.
82 on the second one, but I feel like it's still not enough, and I'm testing this Tuesday.
That's true. So
So-
send me an email immediately after here today, okay?
Okay.
So PMHNP at npexamcoach.com. Write it. I think it would be helpful if you can do nothing at this point. Simply put your PDFs in front of you and go for each one of those PDFs and look at the topic. Hold on a second, not my phone. Okay. And then you'll be like, okay, it's a cerebrum. Out of a memory, what do you remember of the cerebrum? Next topic, the clock drawing test. Out of memory, what do you remember about the clock drawing test? And then you go to the next topic. Out of memory, what do you remember about schizophrenia and so forth? This way you can go to module 1 in less than 20 minutes, because you're not learning, you're revising. All you looking for is the cue about this topic. And then look what you can call out of memory, and then look at the PDF. Oh yeah, I forgot about this TSH level here, and then be able to kind of make a mental note. Another thing for you, Danny, is that Tuesday, right? So make sure you started the dumping sheet, right?
You talking about the Q bank or
the dumping sheet? So the
dumping
sheet
okay.
is the things that are, I would say, that gets you in trouble, like Erickson stages, right? So there is a little way to remember that. So if you start putting that on a dumping sheet, because once you sit down, the dumping sheet is that once you sit down, you have 18 minutes to look through your reading instructions. As long as you not cheating, but you're getting out of your head and you put in a piece of paper that they give you, that's not cheating. You can use the 18 minutes however you like. You can sit there and read all the instructions 10 times, or you can put a dumping sheet on a piece of paper. And then when you get in doubt, what is this stage or that stage, you can look at your dumping sheet and be like, oh yeah, here what it is. Next question.
Got it. Okay.
And I did a video on that, so it would be helpful, very helpful, if you can go on our Facebook group and look for the video that I posted. I actually posted yesterday, or somebody asked me about it yesterday. So that way you kind of like, oh, I can actually do my dumping sheet this way.
Where's the video?
I just posted on the Facebook.
Is it on Facebook only?
I'm sorry?
Is it on Facebook only?
No, it's on YouTube. I'll look for it and I'll post it here. I'll post it on the chat.
Could you send us an email with a link in it?
Yes, if you send me your email because send me your email and I'll respond with a link. No problem.
Thank you.
I can
Yeah.
find it on YouTube. Thank you so very much.
Yeah,
Dr. Lopez.
PMHNP@npexamcoach.com. Send me an email and I'll respond with the link. I don't want to send to everyone because not everyone is interested.
Dr. Lopez, I have a question.
Yes, sure.
On that tubular fungibular pathway, there was a question that I saw on Facebook. I wasn't trying to be nosy, but
Right.
it says that someone said it asked about elevated prolactin can lead to decreased FSH, the follicle stimulating hormone.
Well, it comes from the pituitary gland, right? It could absolutely make sense, right?
Okay.
It makes sense. It could. Because it also remember what are our symptoms. Amenorrhea, galactorrhea.
Okay.
So, yeah, for sure. All right. What else? Did anybody else have a question about anything?
Dr. Charles, do you have a group for people that have already passed that, just in case people
Yes.
pass? Yeah, do you have a group for that?
Yes, there is a WhatsApp group for that. Basically there we're kind of like putting clinical pearls, job interviewing, things like that nature. So it's there is a small group. It's not 100%. I'm not there all the time. So the idea is once I get a little bit of time, I'm going to create classes with clinical scenarios, and they will be free for the people that pass and been in my course. So basically, ideally, creating for sustaining for years to come, right? So that's the goal. I haven't been able to do that. I haven't hardly been able to sleep with my job, this course, and many things that are happening at the same time. But the idea is that as soon as I get a little time off from work, I'll be able to do. I have 100 clinical scenarios that I already made. I just got to record, and that will take tons of time. But eventually, I'm doing this course that's 100 most common clinical scenarios and how to apply the medication to them and why we choose this medications versus this medication. As you can see, this is a half a year of work. I mean, it's a lot. But getting there, for now, I just posted yesterday things about, hey, if you want to write an article, I'll help you establish your name on Google so that when somebody search your name, you apply for a job, they're like, oh, this person actually wrote 3 articles. Look, let's take a look at that. Oh, now they start thinking about you before the interview. That should help you as well.
That makes sense. So thank you very much, Dr. Tails.
Yeah, because not a lot of people are doing that, right? People are looking for jobs, and who are you? Well, I don't know. And you haven't never wrote anything online. Who are you, right? Now, if somebody search your name, like, oh, this guy wrote something about major depressive disorder. Let's see what his treatment of choice is or what he said. Let's see if it's dumb. And we're like, well, I'm pretty impressed. Now, even before the job interview, somebody read something you wrote online. They were like, oh, now they're already thinking how much more they can pay you, right? I mean, it's true.
What's the link to join the WhatsApp group for after passing?
I have to look at it. It is, let me see here. Text me on a WhatsApp 808-230-7858. There has been some other course creators on our WhatsApp. I'm not naming.
Repeat the number again, please.
808-230-7858. That number only works for WhatsApp. I can no longer leave it open for everybody because there have been some course creator buying our stuff and kind of copying it, and has been some people on our WhatsApp that they don't belong there. So I closed the link. Yeah, there's yesterday I talked to a provider. I'm not naming her. I just, it is what it is. It's okay. I'm not bothered by it, but it's okay. It's all good.
808-230-781 again.
58.
58. Thank you so much.
No problem. Next question. WhatsApp only, okay? That only works for WhatsApp.
Okay, thank you so much.
Mm-hmm. Oh, here we go. Everyone should get this one right? Okay, well done, guys. Don't get confused by the option B or option A there. So good job, okay? Oh, that's the answer. All right, so let's take a look at the results for today. Third place, Dawn. Good job. And Senzi. And first place for the night is Catty. All right. Then we have Ebony, and then we have Chris. You guys rock. Everyone rock. Winning is great. Participating is great. But I think those that got things incorrect or didn't nail today, you actually are the ones who benefited the most, right? Because you learned something. And every time you participate, you learn more. And every time you participate, you learn more. I bet none of them got here from starting this first time today. They've been here every week and every time. So I'm not surprised to see those folks killing it and really understanding and being able to speak it. So you guys are rock solid, did a great job today. Keep doing what you're doing it, and next week or a few days later, it will be your turn. You will be a PMHNP board certified. Okay.
Dr. Lopez, I want
yes.
to ask a question. Is there a way I'm supposed to get into I'm new, so I was wondering if there was a way I could get into the Kahoot. I actually answered all the questions right, but I just wanted to find if there was if there was any way, if there's any different way to get into the Kahoot.
Okay. I usually, the only way that I know is to post on the link that I posted today.
Okay.
Have a computer in the phone. It's helpful. So that way you can follow the instructions. So basically, I think that's the way of doing it. But if you're having trouble, come in a little bit earlier. Next week we don't have Kahoot next week. Okay, got my family in town, and is a part of the schedule, the recess that we take. We have completed this, 2 full courses in a row. So I'm taking a little bit of recess so I can gain a little bit of weight. I have been losing weight like crazy lately. So basically trying to reset a little bit, but I'll be available online through WhatsApp and the emails and things like that if you have questions, okay? But next time, please everyone, look at your schedule, okay? Look at your schedule that has been sent many times. Search it on your email. If you can't find it, send me an email to pmhnp@npexamcoach.com. Any questions you have about any topic, any day, give me a little bit of time, 48 hours. Usually I respond a little bit quicker, depending on what is going on, but usually I respond super quick. And reach out to us so we can better support you, okay?
Next Friday we don't have, or next Saturday?
So next week, nothing.
Nothing next week.
Okay.
But remember, you have all the previous recordings. You have the live recordings. You have the PDFs. You have the emails that you can send. You have your WhatsApp group, right? So everything you need is really there for you.
Okay.
Now, if you are new and you're like, oh, I really want to take this in 3 weeks, reconsider your choices. Getting there is more important than maybe getting there, maybe not getting there. I don't discourage you. It's very possible. Many people have done our program in 3 weeks. Now, is that what I advise? Absolutely not, right? I think to really get you there, it takes a little bit of time and it takes a little bit of work. So doing the right way is what I recommend. Taking the time, learning, loving the journey, understanding, feeling confident. That will build your confidence. That will increase your knowledge, and you're like, I'm going to pass. There is no, I think I was home. She said she had 2 jobs already scheduled, right? And she's like, don't worry about me passing. Even though I failed the first time, don't worry about me passing. I will pass. So tomorrow, as soon as I'm finished, I'll bring you my pre-certificate and I'll send to you. Don't worry about me passing. I will pass. And not only she did once, but she did 2 board certifications. She failed the first time, right? I mean, that's fantastic. It could not be better. I mean, she was super confident. She said, don't worry about me passing. It's already passed. And that is the goal, right? And then she prepared for about 2 months, and she really prepared. And she knew it. There was no other outcome. There is only one possible solution. And that is my ultimate goal, is when you feel like you can be so cocky that you can be like, yeah, no, don't worry about passing. This is just a regular day, right? We're just going to go there, show up, pick up what we need to pick up, and then go on with the rest of the day, right? So Danny, I know you're testing soon, so good luck to you, Danny.
Thank you.
Absolutely, I have no doubts. Oh yeah, so what I want to tell you, Danny, is that no one ever feels 100%. But
yeah, that's what a lot of people said too.
Right, no one, because 100% is impossible, right? Could be always one lab somewhere, somehow the things don't quite. But you don't need 100%. You need like a solid 90, and you already proven in many ways that you already got there. So all you now have to do is fine tune. Send me an email today. Immediately after here, I'll be sticking around to kind of look at your email. I gotta go to the hospital and work, but I'll be sending you just extra. You don't need extra, man. You already got this. Let me tell you, you already got this. I know. I looked at your stuff. I look at how much you have accomplished. I can see each one of you guys where you are in the course and how much you have done. I can see how much time you spent, right? So when I say you will pass, I have never got that wrong. One time somebody surprised me and passed when I said you shouldn't test. But I never, when they tell people that, hey, you're good, there is no possible way you could fail. So just walking there with a confidence, readjust a few things. You still have a little bit of time, but it's not really needed because you already got what belongs to you. Okay, so.
Thank you, Dr. Lopez.
Absolutely, and I'm not blowing steam here. I have all the data, everything, every second that you log in and you log out. I know it shows all your activities and where you've been and what you did as far as the program. I don't know what you do at home, but I know exactly each lesson you skipped, the ones you spent the most time. All the data is in the back end that I can see. That's why when I tell people don't test it, it's really, I mean it. And when they say go ahead and test it, you're good, I really mean it. That it's nothing. It's just saying for saying things, right? No, I'm looking at the data right now, and I'm like, yeah, no, you're good. You already passed. You surpassed. You already passed the expectation, my expectation line. Maybe yours a little bit higher, and you want to know more, but I think you're good, man. You're definitely good.
I will let you know.
Sure, I already know the results, man. You'll be okay. All right. Anybody else? Any other questions or concerns or anything is that I can help you with?
I don't have a question, but I
Please.
just want to say that I'm still in school and I start the review earlier, so I will be graduating in April. So I feel like I learn a lot from.
Oh, thank you.
3 weeks. Yes, I learned a lot.
Good. Yeah. I mean, starting while we're in school, it is the smartest way because, sometimes we want things quick and fast, and that's not the best way. So starting while in school is super smart. We had people that, started 3 months, 4 months before they graduated. And I really recommend right? So good job. If you ever feel stuck, please send me an email, okay?
All right, thank you.
Absolutely. All right, everyone. Sounds like all questions are answered. You guys are good. Have a wonderful rest of your weekend. Love y'all. Be good. Study hard, and go
Love you
get
too,
what belongs
Doctor.
to you guys. Okay. Take
Thank
care,
you.
guys.
Thank
Bye
you.
bye.
Bye bye.
Please, can someone give me the WhatsApp number? Hello, is anyone here?
True. Just keep clicking. Nobody quick little thing. You don't want to get quick. Yeah, true. Wait, true. Yeah. Yeah. No, not true. Click on it. Click on false. That's what I'm saying. That's what I'm saying. Wait a minute. At least you gave it a chance to do that in the list. Yeah, well, thanks for showing that.
It says you can share it from.
Please,
Share it to Facebook.
wait. All the above. All of them. This should be the 18-inch. Ma'am, I really need to go.
Did I dismiss you?
No, ma'am, you didn't.
Then you will stand here for as long as I want. teaching.